men, perception of poor working conditions, a stereotype that profession is female dominated, and perception that working with women is female dominated. Also, I want to highlight that we as a team have interviewed many male SLPs. Like, what do they feel? Do they feel any inequality? So they said that no, not according to the opportunity or rights. They do get equal rights and opportunity in our field. The problem lies with the population. Since the population is too much, they do not feel confident enough to participate in a class, as we have interviewed one of the students. Also in the academics as well as in the professional sectors, we can see that in my class, we had 3 girls as compared to 1 boy. For example, in other educational institutes, for example, Aish, Jipmer, we can see there are more number of girls as compared to boys. They are not lacking in the rights or opportunities. They are given the same. Just the population is so much that in that terms, the opportunity is grabbed much more and easily by the females. It's not about that they are not getting equal rights of opportunity. It's that due to less number of men in our field, they are not able to grab that much opportunity. Thank you.
We need to stop. Thank you. That was really nice. Okay. So next, now I'll request Timmy to put up their point and we start to and fro discussion of the points. But we need to keep in mind that only one person at a time will be allowed to speak. Unless and until the other team is not finishing their point, you cannot start midway. We need the judges to hear you clearly. Otherwise, if you start speaking together, the points might get missed and judges and the audience won't be able to hear what you're discussing. So please make it a point that you are clearly audible and you go one by one. So team A starts with their point and your 20 minutes starts now.
So our topic is that there is gender equality in our field, that is speech and hearing. So my respected opponent team pointed out that there is a scarcity of males in this field. Why there is scarcity of males in this field? You also pointed out the facts, because there is lack of awareness, or maybe the perception of poor salaries, because our field is still getting developed, and then perception of poor working conditions and stereotypic mindset that the profession that this profession is female, the feminine occupation, and perception that working with children is a feminine quality. So, but we also ran informal research and found out that in this conference itself, the male population who attended the conference is very less in compared to the female population. So that is 12% of male population to 88% of female population. But I would like why there is scarcity of male population. That is not because we are not giving equal opportunities for the male population to get into our field. What is gender inequality? Gender inequality, getting you back into the definition, gender inequality defines that male or female is not getting equal rights or equal opportunities to bring out their maximum, or to bring out the potentiality within them to function as a speech language pathologist or an audiologist in our field. But there is nothing like that. There is no reservation, there is no boundaries for them. It is just that their choice of selection of profession is different. Why that is because of social stigmatism. Because from small days, our parents used to restrict us. As a girl, we should be playing our role. As a girl, as a boy, we should be very masculine or very active, right? So that is how we are brought up with. So along with that, men tend to choose professions which bring up their manlyhood, that is strength or power, or maybe the stable salary that they get. But still they have that competence or the traits to become a good speech language pathologist or an audiologist. So it is not that there is inequality. There is no inequality. We give them the equal opportunity. We give them the equal rights to practice or to enter to this field. But it is that their choice of profession is in another field. That is why there is less number of male proportionate to the female. It's not that there is inequality.
Okay, 1 minute before you start. We need to keep our pointers crisp and short so that the other team also gets equal opportunity to speak, because we have stipulated time of 20 minutes. So both the teams should get equal chance. And 1 minute, just a slight announcement.
This is regarding oral paper presentation. We've only received the PPTs from these many people. That is Jayaprada ji, Kamolika Sarkar, Harish Murali, and Janvi B. Prasad. Other than this, we've received Cheryl George and Alina Anna Thomas, but we're not able to open it. So I request Cheryl George and Alina Anna Thomas to kindly resubmit their PPTs. Other than these people, we've not received anybody else's. So if any of you sitting here are participating for it, kindly submit your PPTs immediately to the registration department.
Okay.
And,
Vishal, yeah.
Just one more. You can either mail it to soumyavivek07@gmail.com. SOUMYAVIVEK07@gmail.com. Thank you.
Yeah, so now we can continue. Sorry for the interference. And so we need to keep our pointers crisp and short. Continue.
Yeah, I agree that according to the definition, this is not about that equal opportunities are being given or not being given. I agree that this is not a structural error. I would like to say this is more of an functional error which has been created, an artificial error which is deviating the gender inequality from its exact definition. For example, when we interviewed our seniors, our junior batches, our super senior batches, there were like 4 or 5 males over the 44 females. Like I'm studying in Aish there. Back in PJMER, Chandigarh, like Jipmer, when we interviewed them, they also stated that 1 boy or 2 boy over 10 girls. So these were the population. So when we asked them in the classroom, like why you do not interact, why you do not ask questions in the classroom, they were very crisp. They're like, there are so many women in the class, we feel very inferior or shy or introversy because our population is very less in the classroom. And these were the very clear answers stated by them. Not only the one batch, as per 6 to 7 batches males, they responded in this way. So this taboo has been created that their choice is being deviated, what they want to do, what they're interested. But when they because of this fake belief and fake perspective, when they realize ki no, there are very less opportunities, there is very less salary, and working with children, working with toys, using toys with children is more of feminine part. Children are more interactive with women rather than males. So these are the fake beliefs, perspectives which has been turned into a taboo, creating an artificial error, deviating the structural definition of the gender equality. So this is we would like to say.
I would like to counteract that point. Like my opponent team said that there is an artificial error, I would like to say some research for the same. There was a research done on emotional regulation between men and women, and research said that women used more of emotional regulation strategies. Being a part of SLPs, we have to give really hard facts out that your child is disabled, or he has a hearing impairment, or he cannot swallow. So social bonding is very important, even in terms of counseling. Research also says that women are more likely to express happiness, warmth, and fear, which definitely helps in social bonding. And it's also very consistent with the role of a primary caregiver. Whereas men are more prone to show attributes of anger, pride. So I don't think it's a vague phenomena. Even research is supporting the fact, and there is no inequality. However, I would say that there is a gender preference. If my child has a speech problem or a hearing impairment, I would prefer a woman to see, because I would feel, oh, she'll be more safer in the hands of a woman. But that would not be an inequality. It would just be in terms of the gender ratio, not otherwise. The rights, opportunity, facilities are exactly the same. And we know of 10 and thousands of men who are doing very well as SLPs. Also, we cannot rule out the fact that my opponent team mentioned that, women are ahead of men in this field. Men are only representing 20% of this field in India. And still, there are 10 or 20 men that I know who have done great in the field. There is Nachiketa Raut, sir. There is Prasanna, sir. There is, Shiv Kumar, sir. So I think in spite of being 20% of the population, their work is phenomenal and should deserve all the applause.
Yeah, we agree with all the facts my opponent team has been stated, and all the males are male lecturers are professors working in the field. So when we share all these facts and research with them, so they agree that yes, we have come this far, but we are working so hard with the males who are reluctant to participate in our field. And we strongly believe, like when a group of children, like females, are given priority to interact with children, like let's say for AVT. So when we are giving opportunity, or we are motivating the male clinicians to interact with the children on a long term, children tends to get adapted with them, and they tend to enjoy interacting with them too. So it's just about this fake belief, this fake taboo. We really need to work on that. And now, apart from that, the fact you just have stated, that ratio difference. This ratio difference is so huge. Like in the classrooms, 4/50, four males over 50 girls. That is so significant that we have to look after, like what is, where is exact error, is like where the exact problem lying, right? So it just can't be stated that only it's about the choice of the males, that they don't want to be in this field. Some error, some significant error is being lying around, that is making them exclusively reluctant to not participate in this field. If they have joined the field, they are trying to avoid like interactions with children, or still they are believing that no, this activity is more of feminine like. So we really need to work on these things.
I agree with the fact that you say that there is a social taboo which is going around, which makes them inferior, thinking that it makes me shy to come out because I'm coming from a very less population in this field and all. But I would also like to say that there was a study conducted by Mu et al. Regarding empathy, gender effects in brain and behavior. So he states that there is a stereotypical portrait that females are more nurturing, have more nurturing qualities than the males, and males are more into the cognitive side than dealing with the emotions. So, but researchers have also surprisingly shown that the masculine traits which we see as a very strict traits we see in masculine, that is competitiveness or the adventurousness, dominant, aggressiveness, all these things are also linked to more positive parenting, nurturing behavior of this male population, because that is anyway brought to us evidently by the male pillars in our profession, just like she mentioned, Bhaskar sir, Prasanna sir, then Dr. Ratna, Dr. Goswami. So all those are like famous pillars in our field who has done a lot, who has that capability to give the maximum to the field, and who has shown that these dominant traits, the masculine traits, are capable of nurturing the kids up to the elders, and helping them and helping the growth of our field. And also, even not only in our field, even in gynecology, even in physiotherapy, all those fields have this inequality in number. But that doesn't say that there is gender inequality as per the definition which is given by the world, by the UNESCO, because we give them the equal rights, equal opportunities. It's just that their choices are different because of this taboo, social taboo. Otherwise, there is equality.
Okay. First, I would like to contract the point that since you said that women are more into nurturing and they have more empathy as compared to men who are more on cognitive side, right? So if we have a research like that, and if we have a mindset that women have more empathy, then indirectly, are not we saying that women should be given more opportunity towards the parent, towards the patients, since they have more empathy? Because since my first year, Dr. Banumati was my professor. She taught me I should have empathy with the patients. Sympathy is something that everyone have. Empathy is something that makes me a clinician. So are you trying to point out that empathy is more in females, so she is a better clinician? Since you gave the facts that Prasanna sir, and there are many more males that are doing very fine in the field. But due to the less ratio, and since also you said that females are preferred more by the parents as compared to the male population. One of the fact my fellow friend said that females are preferred more by the parents as compared to the male. So that is what mindset we are talking about. That if in a clinical setup there is a male and female, and the parents choose a female over a male, that male is deprived of the opportunity of the patient, right? So that is we are stating the fact. It is due to the mindset of the people that they are not given equal opportunity. It is somewhat taboo. It is in the mindset of people that we want a female clinician. That is the reason the male are deprived of the opportunity and rights. It's not like personally or as an individual in a community, we state that male are not male are not ahead or male are more on cognitive side, so we are better clinicians. No. In the community, we know that a male can do equally better like us. He has given equal opportunities, and like other males who are given opportunities are doing well, because I think they in the clinical setup they did not find a parent like that who said that they prefer a female clinician.
I would like to add on to that. We just gave examples of a lot of men who are doing great in our field, and we also have to understand that gender and sex are two different things. Sex is more about the biological and the physical characteristics, but gender is a social construct, which very well implies that it is amendable. It can be changed so that we can make the society more fair and more just. We also have to understand that there are often old-fashioned notions which are there in the society, but it's not just in the field of speech and hearing. When we say that we need to provide more opportunities, there is an open ground for men and women to come and battle with us on the same way. There is no reservation, there is no percentage. It's just a matter of choice. For example, physiotherapy and psychology. These are fields which are of rehab, and they have the similar attributes as that of an SLP. Only 2% people of men are there in the gynecology department. So that is an even bigger difference. Only 38% men are representing the field of psychology, which is even a bigger difference. So that would not say that there is a gender equality in the field of inequality in the field of gynecology or physiotherapy. It would simply mean that equality is there. Opportunities are equal. It's a matter of choice. And if it was so, we would not have so many successful male practitioners in India as well.
As per se, you noted, yes, that there are successful males in our field because they were given opportunity and rights. Okay, they were given opportunities and rights. I agree that there are no reservations, no women quota in any field or anything. Yeah, but I also want to highlight regarding, there is an example in North India regarding the government jobs that are reserved for women, right? It's okay, we are promoting women. But what about the government jobs in the field of SLP in Baba Farid University of Health and Sciences Faridkot, which do offer this course and has government job? Why was it reserved for women only? I just want to ask this. I know that the change is inevitable. It's going to happen now or tomorrow. But in the current scenario, I feel somehow that there are reservations highlight that much, because as men, as you said, they are more on cognitive side, they are more on practical side, as the research stated. So they somehow compromise with the fact that it's okay, if she's getting a reservation, I will get another opportunity. So due to these practical men thinking only, they are doing so well.
Since you pointed out that I said that females have more nurturing qualities than males, I also contracted that part in the same speech, saying that there are researchers surprisingly stating that the masculine traits have brought them to become good nurturing parenting behavior out of them. So what I'm saying is they are equally capable, just like us, to be nurturing ASLPs in this field. Not that I didn't mention that they are not empathical, just like the females. Plus, I would like to say empathy is what? The ability of us to put ourselves in the shoe of someone else and think and act accordingly. So our brain capacity, the brain of the human, this is irrespective it's a female or a male, the brain of the human is capable of showing empathy, irrespective of what gender we are. So what we were saying is this gender inequality, what we all are pointing out is in numbers, that the numbers are not equal. Female population is more than the male population. But that is not gender inequality. Gender inequality in definition is we are not giving them the equal rights and opportunities. But in our field, there is nothing like that. Everybody is getting equal rights, equal opportunities.
Last 3 minutes to go. You need to keep your points short and crisp and to the point. Put your best points forward.
Yeah, so I would just like to add few more points to the opponent team and to my team also, as Siddhi just mentioned that many male clinicians in our field have like they are doing very good. So I'm 100% sure, like Prasanna sir, they must have faced issues like when parents are preferring female clinicians over male clinicians. So I am 100% sure that they must have a parent well that no male and female clinicians can do equal jobs, and that's how they must have tackled the this taboo in their clinical situations and setups. But there are somehow like other male clinicians, like the undergraduates and the postgraduates in the clinical setting, maybe they have believed upon this taboo. And apart from our field, like other fields, physiotherapy, gynecology, their job is entirely different. Like if we talk about the gynecology field, a female is talking about her physique and her disorders, so they are more comfortable with talking with the female gynecologist only. She is going to share very private things about the gynecology only. So it is entirely different from our field when we are talking about the other field. And more of the less, like in if we talk about the parents, like mother is only coming with their children, and we are always counseling the mother, please get the father also, so that children get to develop the emotional bond with their father also. In the home setup, like mother is interacting and doing all the activities with their children, and fathers are the least one who are participating with their children. So we want that yes, fathers participate with their children more, male clinicians are participating in the clinics with children more. So we just want them to participate more, enjoy the opportunity which is being given equally.
Let me get back to what the objective of gender equality is. Gender equality is creating a healthy society where men and women enjoy the same opportunity, rights, and obligations in all spheres of life. And we need to acknowledge where where gender inequality exists. It exists when we are excluding or disadvantaging a gender in terms of decision making, access to social as well as economic resource. Therefore, a critical aspect of gender equality is empowering women. Having said that, we all have heard this thing of, first women to become a pilot, first women to become a doctor. Have we heard that in our field? No. It's just a matter of choice. And when I'm a patient, my only concern is if the professional can cure my child or my relative or my father or no. I will hardly be bothered whether he's a man or a female. If I have a conviction in the person, I will not see his gender. I will trust the person to cure him. But gender will not, I don't think anybody will have that construct key, okay, this practitioner is a man. I don't think I'm going to send my child to him. I will only be concerned, can you cure my child? Do I have that belief in him? If yes, I'll go ahead with it.
Okay, I would like to continue the same scenario. The same mother who is attending the clinics there, and same mother is coming back home, and like after many therapy sessions, she's coming back to the clinics and saying, ma'am, just does not participate in the therapy session when I'm home training session when I'm taking with my child. Only I am the one who doing all this. My husband just doesn't participate with my child. And now we are in the same situation. Like in the clinics, in the beginning, mother was saying that yes, irrespective of the gender of the clinician, I want my child to be whatever comes, let us come with. But at home, after many sessions, like single mothers or the mothers parents are also have believed that okay, it's a feminine job, she will do it. So again, we are there.
I
Okay.
would just like to take
No, sorry. Yeah. So before things get heated up, let's change the topic. So now, moving on to the next round. It's the open round. Your team gets 2 questions. The questions are supposed to be asked by the resource person. So you get 10 minutes in all and ask the question, and they have to answer the same in 10 minutes. Each question needs to be answered separately. And you have to ask first team B, you will be asked question to team A. And after you finish your 10 minutes, team A will be asking the question to team B. You have to ask both the questions together. No, the timer starts. For them, the timer starts. You take 2 minutes. You ask the question. Once you ask, the time starts. You need to ask. No, it's their turn to ask you. Once they have already asked the question, your timer starts. You all need 2 minutes for discussion. Are you all ready? Team B? Are you all ready? You all need 2 minutes of 2 minutes. We'll start the timer for 2 minutes. Both the teams can prepare their questions.
Hello, I'd like to know from the audience, whom do you all support? Are you all for gender equality or against gender equality?
Yes, I believe there is gender equality.
Okay, we have 1 for 4. Next, what do you think? Do you feel there is gender equality in our field?
Yeah, there is.
Okay, we have many supporters here. That's great. Would you like to share what's your view on it?
Professionally, opportunity-wise, there is an equality, but when it comes to the practice, I have personally experienced this. Patients prefer female therapist over male therapist, so I did not.
Okay, so we have 1 person against. That's great. We still have time. Okay. Okay, so we start. Team B, ask your question.
My question is, as you reported all the facts, but my one concern is, what about the inequality in the mindset of people? What do you comment about that?
I would say
1 second. And your second question?
And my second question is, as per the light of standard definition of gender equality, should we ignore the facts that interviews and practical clinical setups which we did? There's a huge difference between the participation of males in our field.
can you repeat your first question?
First question. My question was what about the inequality in the mindset of people? What do you comment about
Right.
that?
So I wouldn't say that there's an inequality in the minds of people. There is a notion, and gender inequality exists on the grounds of gender preference and gender ratio, and not in terms of rights and opportunities. I were to sort of do a provision to provide men more chance. That provision is already existing. There is enough provision for the training, opportunity, certification that is already provided to men. Now it's a matter of choice. And social stigmas are changing. There is a reason why there is a huge fan following for Shiv Kumar sir, for Dr. Ratna sir. Nobody really tells them that, oh, you're a man, so I don't think I should take my treatment from you. They are equally being respected and sought after. So I don't think that there is a notion regarding the gender. However, there is a notion regarding the efficacy and the effectiveness of work that you portray, irrespective of your gender. I could be a women SLP doing really bad with my profession, But that has nothing to do with being a man or a woman. A man could be great. A woman also could be fairly not. Just a matter of passion.
Can you repeat your second question? So, as per the lifestyle standardization of gender equality, should we ignore the facts, the issues, and the practical setups, which is stating the huge difference in gender participation? Actually, I don't see that inequality in the practical setup. If we see, okay, if we go and see, like just like she said, the pillars of the male pillars of our field, he is performing the maximum. There is no boundary there where the doors are closed. I'm saying that you can. There is no boundary given that the females can go up to this extent and the males have to stop from here. So when in the clinical setup, they have equal, is nothing like that, right? Did I answer your question? No.
No, it is okay. The answer. It's your chance to ask the question.
You stated that there are a lot of gender inequality in our field. In that light, what are the measures you would like to implement in the, if you want to bring more gender equality in our field?
Yeah, that's a very good question, and I would like to keep my answer crisp. Like one, when the we will ask the mother, like, please kindly bring child's father to the therapy sessions, and we will involve child's father in the therapy sessions, and we will counsel the father, we will motivate the father, we will tell them the facts, show them the facts, and once they will experience their child's bond is being increased with them more, they will be more participant, they will be more willing to participate with the child in the therapy sessions. And similarly, when I earlier male clinicians in the field, they definitely must have faced this taboo that where parents are preferring the female clinician over a male clinician when it comes to the interaction with their child in the therapy session. So I'm sure the successful male clinicians, they are counseling the parents again well about that. Yes, the both the job being done by female clinician and male clinician is equal, and there is they can work on this taboo which is in their mind, and they can definitely counsel the parents about it. Similarly, when in our academic session, we can definitely work with our male batchmates. We can motivate them to ask to interact in their classrooms, to interact more with us, with their teachers in their clinical setups. We can push them to participate or interact with children, to take more cases, more pediatric cases, child language disorder, which they usually are reluctant to do. So in these 3 to 4 roles, that's how we can work on this, which we stated earlier.
Um, I would like to contradict your point. The question I've asked is, what are the measures you would implement?
They answered. Move
Yeah.
ahead. Second question.
Yeah, you said that more often parents should be counseled, but the topic is gender inequality in our field. So what would be your comment on that?
Yeah. So where a mother is preferring female clinician over a male clinician in the same at home setup, where father is reluctant to participate in the home training session with the child. So somewhere it is dynamics of the same scenario, and it is going around the same scenario. So we are working at the facts which are contributing to the child's therapy, male taken by female clinician versus male clinician. One, if mother has a taboo about the female clinician versus male clinician, same is at the home. Same is at the home. Father is reluctant to participate in the home training session. So somewhere we are moving around the same thing.
But the husband is
Okay,
not innocent.
okay. No, we are not arguing on this topic. So you asked the question, they answered. Okay. So next is judges question round. I would like the judges to ask one question to each team. Each team, yes, ma'am. Separate questions.
Yeah. First, I'll ask the team B. According to you, there are more females, right? More lady lady speech pathologists. How can you change that? Because when it has started, you guys are at least lucky. You have got more male students in your institutes. Where we have studied, hardly कोई एक 4-5 साल के बाद में एक लड़का आता था, right? Yeah. So then how are you going to change it? That inequality. Do you have any choice?
Ma'am, we do not have choice. That's as you said, but always we can motivate our male clinicians and male batchmates to participate more so they get equal opportunities and they get equal rights.
No, no, no.
Uh,
Continue.
Yeah,
yes,
ma'am.
1 minute.
Answer.
You are, see, you don't have choice. You agreed, right? And what you are doing, even they are doing. When the debate started, there were male participants with you. Though I didn't attend the full debate, they were. Now only 6 females are there. What does it suggest? I'm proud of you all, really. All 7 of you. Maybe because I'm a woman, but even if would have been a men's panel of 7 men, I would have been equally proud of them. Because you are our professionals, our people, right? Now, you got a very cute this topic, that gender equality. So without fighting, you are going to win. What do you think, how you can change this situation?
Right, ma'am. Ma'am, I feel we can't call it gender inequality because opportunity rights are the same, which are being provided. However, there is a study done which tells the reasons for less male population in the field of ASLP, and I would like to work on those reasons. First is lack of awareness. Not many men are aware of this profession. Perception of poor salaries. They have this image that you will not really earn much as a ASLP. Perception of poor working conditions. Stereotypical mindset that the profession is predominantly for speech and hearing, and it's like a female-oriented perception, and also the perception that working with children is feminine. I would like to work on changing these perceptions. But there is nothing in terms of rights and opportunities that we can provide because the battleground is the same for men and women.
See, about salary, I like to state something. I have 2 nieces. One has done her audiology speech BASLP from Aryavajang. She started with the salary even after UG with 35,000. Do you call it free, poor salary? And her sister, who has done BE in mechanical engineering, she didn't get through her campus interview and she's landed up in getting 20,000 rupees ka salary start. So then, in spite of that, always you are telling that there is a poor salary, poor salary. Please don't mention that because salary starts somewhere and we have to go on proving yourself and we go somewhere else. All of us who are senior here, we have all gone through that somewhere or somewhere in our life. You can ask anyone. And I feel, I don't want to say that, but female are more hardworking. Female like there means not there, up on the higher side of the ladder, and maybe male are not doing that much work. I'm not calling them lazy at all, but maybe they are not putting that much effort for whatever reason. And in our society, male have to draw more salary for various reasons. Am I right? And your classmates, so many times you must be taking their help. I'm really thankful that you have got only male and female. After 2 years, you have to add all LBQR, right? Yeah.
I have one question for both team A and B. What about women in the field and inequality towards women? Why do we talk only about male and that there is inequality against male? Do you all have an answer?
Yes.
Okay,
Ma'am,
so-
so like you rightly pointed, it's very important to acknowledge where gender inequality exists. It is generally where women are excluded or disadvantaged in relation to decision making, as well as access to economic and social resources. Therefore, a very critical aspect of gender equality is empowering women. and this is said by UNESCO and not Team A. Empowerment of women with a focus on identifying and redressing the power imbalances and giving women more autonomy to manage their life.
Okay. So coming back to the social and economic considerations and how there is no gender equality, etc. How many organizations give women maternity leaves? How many organizations allow women to grow after a break that they've taken from a point of no break kind of a thing? How many organizations are giving women flexible work timings? How many organizations are giving women other incentives and et cetera, during this maternity leave that they're taking, or they need time to take care of their children, etc. Because women, they go through the delivery process and feeding process, etc. So what about gender equality there?
We answer that.
And y'all can, this is a point to ponder.
Right.
And if you all want to answer, I would be really happy.
Team B.
Thank you, ma'am, for pointing this out that we are just talking about men, but somewhere being in a female dominated profession, we forget about female only. That I feel that we do maternity leaves, not in every setup, like it's not mandatory. So there are many colleagues of mine and many seniors that they had to leave their job because of the taking care of their children. So I feel, yes, there is an inequality in that sense. Also, ma'am, in many countries, we can say that every month, if a female is facing periods and it is very painful, they get leaves for the same, but it is not the same with our private clinics. So it is kind of some inequality that do exist that we do not really talk about and bring this topic ahead. But yes, it do exist in our field also somewhere. That is not very but not very talking but not very well spoken. So yeah, thank you so much for talking about that.
We'll continue, ma'am.
One thing I like to add, all organizers, they are working so hard. If you'll ask these all girls, most of them they married, maybe recently married, or they are having kids at home. When they left the children and come here, small kids, they are come here and working day in, day out for that. That gives the answer to that why gender equality inequality exists. I don't have to tell more, right? Yes, sir. They have answered themselves.
Thank you, ma'am. So we have come to our last round for today. And we have the conclusion round. Each team gets 3 minutes to conclude the statements. You just have to put forward conclusive statements about your own topic and do not counter or oppose any of the points that the other team is saying. So we start with team A.
To sum it all, gender equality is the access to rights and opportunity irrespective of gender. And it doesn't mean that women and men are equal, but it means that women and men are given equal rights and opportunities. So gender, to sum it all, gender is an economic, social, cultural attribute which is given. And it is not simply that being a man or a woman is not simply better, means better in physical or biological characteristics above one or the other. So gender is literally different from sex, that is male or female, because it is social and cultural in nature. And in fact, that gender is a social construct. It implies that it is amendable to change in a way that the society can be changed into a better place. And gender equality doesn't stop at representation, diversity, or inclusion. It also is about who has the ability to help us imagine a future in which is good for all and everyone in the world. So that is gender equality, and that gender equality in our field.
Done? Okay. Thank you so much, both the teams.
Okay, there.
So sorry, you were left. Okay, I'm so sorry. Team B.
Yeah. So I would like to recapitulate, yeah, that gender inequalities exist in both the genders in different contexts. Okay, so we have to look forward regarding the mindset of people, that there is a functional error that has been created in our society that needs to be changed, and it's not inevitable that it will not change. It will happen. It will happen in the future. But if we talk about current scenario, both the sexes, both the genders face inequality in some or different contexts, whether we talk about private clinics, hospital-based setups, academics, maybe that is not being much talked about, or maybe we are not that active enough to talk about that, but we do feel that there are some inequality that we face as female and as well as male. And what we can do as a professional is that we all can support each other. We can talk to each other. We can motivate each other. And lastly, to conclude that, no doubt that there is no inequality in terms of rights. Like there is no women quota in any college, but still there is some inequalities in terms that is not much talked about, that should be highlighted.
Okay, thank you so much, both the teams. That was an amazing discussion which we had. So both the teams tried very hard. So please give a round of applause for both the teams. Okay, so now I would like to request Chitra ma'am to kindly announce the results.
Hello, can you hear me? Yeah. That was a tough competition between team A and B. We thoroughly enjoyed it. You all had wonderful points that you brought forward to all of us here to listen. Of course, you all missed inequality against women. Okay, so with regard to the points, I don't want to put you in suspense. I will come to it in a minute or two. When we talk about inequality against men, well, there is a point that parents prefer a male therapist, which we have witnessed. There is also the fact that women clinicians are not considered for maternity breaks. They're not considered for, all the other things that happen after the baby comes, taking care of the baby, nurturing the baby, breastfeeding the baby, for all of which women tend to stay back at home. Many organizations just give them, laid off, or, they don't even consider that as a leave. When they apply, they have to apply from the scratch. Okay, these are some things that we haven't talked about, but this is the fact out there. Talking about equality again, it's just that the number is higher. The more men, the more women compared to the number of men in our field. That is something that we cannot argue against. That's a fact. And like you said, it is important for us as the women majority of the field to encourage the men counterparts, the male counterparts, to be a part of what we are doing as a team and encourage them and be there, bullying them like some of them are in the habit of doing. So that is something that I think we can consider on a light. As for the winners, we're not going to talk about the for or the against who's become the winner. We're going to talk about how did you all do the organization and clarity of the points that you brought forward, the use of arguments, use of examples and facts, use of rebuttal, answering questions, how you've answered it, presentation style. Based on these factors, we announced Team A as the winners. So let's give them a round of applause.
Congratulations, Team A. But it was a tough fight from Team B too. So congratulations to you all too. Okay. So we end the debate round here. Hope you all enjoyed. And thank you for all the participants. We continue with the next sessions. Thank you.